Oh, so cute. Okay, we're going to talk about these kittens in a minute. But first, it's called primary care physician for a reason. They can take care of basic health issues, but they also know when to refer you to a specialist who can treat more specific problems. Paige McCoy-Smith sat down with Dr. Bob Morrow with Blue Cross Blue Shield of Texas to explain more about that patient-doctor connection.
Good morning to you.
Good morning.
Let's talk about it. Why is it so important to have a consistent physician in your healthcare routine?
Well, as anybody who's actually accessed healthcare knows, healthcare is incredibly complex. And having your own physician, a primary care physician, who not only understands the healthcare system, but also understands you, often like me, I'm a family physician, understands your family and what's going on medically and otherwise. Having that physician guide you through healthcare is incredibly important.
All right, well, let's talk about why is it so important? What is it that makes a primary care physician different than, say, a specialist?
Well, it's their ability to understand basically a very broad range of medical problems, and also to understand preventive care and wellness, and understand the best ways to help patients or family members not only get healthy but stay healthy. As a primary care doc, I would often tell my patients the most clinically and financially effective way to manage an illness is, in fact, not to get one. Or if you get one, to identify it early and treat it effectively. And primary care physicians are trained to do just that.
All right, so where can people find a primary care physician?
Well, so for us at Blue Cross and Blue Shield of Texas, the best thing to do would be to look at the number on the back of your card or go to our website. Very important to choose a primary care physician who is in our network. And you can also, if you access those two, if you access the phone number or the website, there's other information that can be made available to you that really help you make a good decision.
All right, what are some tips you can give us when it comes to looking for a primary care physician? What do we need to keep in mind?
Well, first and most important, as I said, make sure they're in your network, and then you probably want to choose somebody who's in a location that's close to you. And then you need to think about things like, do you want a family physician? Like, do you want your children, maybe your spouse to also go? Or would you prefer to have maybe an internist and a pediatrician? It really, some of that just depends on family preference and what you're used to.
You have some exciting news. You recently made an announcement by working with a group of primary care physicians. Tell me more about that.
Very excited. So we're working with a group called Sanitas USA, and they're primary care physicians who have developed a strong history of a physician-driven, primary care-based model of care in medical centers. And we're going to be putting about 10 in, 4 in the Dallas region and about 6 in the Houston region. And we're excited about this because it's kind of a one-stop shop for primary care.
That's wonderful. It's exciting news. Well, I'm really grateful that you came today to tell us the importance of having a primary care physician. It made it clear to us that if we don't have one, we need to take the steps to make sure that we have one so that we can see that physician regularly and not just rely on a specialist.
Thank you so much.
I do appreciate it very much.
And for more information on the Blue Cross Blue Shield of Texas partnership with Sanitas USA and the importance of a primary care physician, visit their website, standingwithtexas.com.